Hey, Dr. Pound here, and today I've got 3 easy stretches for you to try to help reduce shoulder pain. Hey, Dr. Pound here from Heal Better Fast, and today I have 3 tips for you to try if you start to experience shoulder pain that you can do at home or at work. These are based off my clinical experience and research so that hopefully you can stop the pain before it gets to the point that you need medication, injections, or even surgery. Now, of course, if you're experiencing shoulder pain and you don't know what's causing your pain, I highly recommend getting it checked out before trying different things. However, the 3 tips I'm going to give you today are pretty simple and benign. A lot of times they help people with shoulder issues get out of pain and get relief until they can get into a provider to figure out what's causing the pain. So tip number 1 is a very simple stretch, and what you're going to do is you're going to take your hands and put them together, palms facing down. Only you're going to do this behind your back. So you're going to reach around behind, place your fingers together, put your palms facing the floor, and you're going to press down. What this does is this opens up the front part, stretches your pecs, and helps decrease some of the tension which can be impinging in the shoulder. It opens up the shoulder joint, allowing more circulation to be able to go through, taking tension off that area, stretching the tight muscles in the front, getting the tension off the back of the shoulders, really opening up the shoulder girdles to take some tension off the shoulders. Up to 2 minutes of just pushing down a day can really help decrease some of that pain in the shoulders. Tip number 2, Codman's pendulum. Now this you can do by simply getting something light or even without weight, but I do prefer to use a little bit of extra weight, like maybe a milk carton or water jug or something, just to pull a little bit on the shoulder to open up. Again, when you've got shoulder pain, a lot of times that can be due to some sort of impingement. Tip number 2, Codman pendulum. So what you're going to do is you can take something 10 pounds or less and you're going to hold it in your hand. And then what you're going to do is you're just going to place another arm on like a table and then let your other arm hang off. And you're going to simply rotate it like a pendulum. And what this is doing to the side is you're getting the weight to pull gently on the shoulder and to elongate the shoulder to get pressure off, open up the shoulder joint here, and allow that inflammation to hopefully be pulled away from that area to allow less pinching in this area. So again, you just do this about 20 times clockwise, and then you swing it the other way 20 times counterclockwise. You're using the weight. Your hand should just be gently holding the weight loose. Let your whole arm loose, shoulder loose, to really pull that forward and get pressure off that shoulder, to open up the shoulder joint and get tension off the shoulder. So the second tip, Codman's pendulum, you simply take that, do some circles with your arm and your hand, and open up that shoulder joint. And tip number 3, you can use a ball of some sort, a tennis ball. I prefer a lacrosse ball because it's got good density. It's shoulder rolling. So you're going to take this, you're going to put it against the wall, you're going to lean against the wall and roll your shoulder. Now if you bring your arm up behind you, you can really open up the space in between the shoulder blade and your thoracic spine to allow the ball to get up and down in between the muscles that commonly cause tension in the shoulder. Now once you get the ball behind there, you can trace the shoulder blade by leaning against the wall and moving your arm different directions. You can start your arm out and then bring it in to open up the shoulder blade. You can even bring the arm up and down with the ball behind the back in between your shoulder blade and the wall. Lean up against the ball. You'll feel a little bit of pressure against the ball, and you'll find those trigger points, those areas of extra tension in the muscles around the shoulder. And once you find one of those with the ball, you just lean up against it, hold it for about 20 seconds, and then move to the next point. When these muscles get bound up, they can pull your shoulder blades uneven and cause undue tension and even impingement type pain. When this happens, if you can loosen up these muscles by simply rolling, it can really help you feel better quickly. Now, of course, if you roll for too long, you could aggravate an area that's in spasm. So make sure you know what's going on first before you just try these stretches or exercises, because doing the wrong stretches or exercises can exacerbate a problem if you're not treating the right problem. But for common shoulder issues that I see in my clinic, my patients with shoulder pain can get out of pain quickly by incorporating these 3 simple stretches into their daily routine. So the next time you have shoulder pain, you can try these 3 tips to try and help relieve some of that pain. And if you're finding these tips aren't helping and you would like to avoid drugs or surgery, go ahead and give me a call and I'll give you the best advice I can. I hope you find these tips useful, and I look forward to bringing you more tips to help you heal better fast.